Hello, I am Jerónimo Farré, and on behalf of Professor Hein Wellens and myself, I will present you this video entitled An Introduction to the WPW Syndrome. This is the first of a series of videos on ventricular pre-excitation produced for ECG Corner videos. What is the WPW syndrome? In 1930, Dr. Wolf, Dr. Parkinson, and Dr. White published a paper in the American Heart Journal entitled Bundle Branch Block with a Short PR Interval in Healthy Young People Prone to Paroxysmal Tachycardia. In fact, they describe most of the characteristics of what we call today the WPW syndrome in the title of their original paper. Note that they thought that this wide QRS complex, that was one of the characteristics, electrocardiographically speaking, of these patients, was due to a form of bundle branch block. They also noted in their original contribution that these people frequently suffer episodes of supraventricular tachycardia. What causes the WPW syndrome? In 1933, only 3 years after the original publication by Dr. Wolf, Parkinson, and White, Dr. Wolferth and Dr. Wood published a paper also in the American Heart Journal that was entitled The Mechanism of Production of Short PR Interval and Prolonged QRS Complexes in Patients with Presumably Undamaged Hearts, Hypothesis of an Accessory Pathway of Auriculoventricular Conduction, and they wrote in brackets bundle of Kent. In this paper, they claim that the electrocardiogram during sinus rhythm in these people was the result of a fusion of two activation wavefronts. One proceeding via this accessory pathway that they had called bundle of Kent. This drawing is from the original paper. And the other wavefront proceeding to the ventricles from the atria via the normal AV node, his bundle branch system. They also postulated that the atrioventricular conduction times via the accessory pathway were shorter than the AV conduction times via the normal pathway. Because of these shorter conduction times via the accessory pathway to the ventricles, the PR interval was short and the initial forces of the QRS complex were slow. Also in this paper, they postulated that the mechanism of tachycardia, of the most frequent type of tachycardia observed in these people that lacked of ventricular pre-excitation, was due to a circus movement that was using the normal AV node his pathway as anterograde limb of the circuit and the accessory pathway as the retrograde arm of the reentry pathway. Why did Wolferth and Wood call bundle of Kent to this accessory pathway? The reason is that in 1913, Stanley Kent published a paper entitled Observations on the Auriculoventricular Junction of the Mammalian Heart, in which he stated that at the right margin of the heart there was a muscular connection between the atrial and the ventricular myocardium. And then Wolferth and Wood thought that a connection like this one could explain the WPW syndrome, and this is why they call this accessory pathway as bundle of Kent. What is today the WPW syndrome, and what is what the guidelines say? The 2015 guideline of the American College of Cardiology, American Heart Association, and Heart Rhythm Society on supraventricular tachycardia indicate that to diagnose the WPW syndrome, you have to have two things. One is ventricular pre-excitation during sinus rhythm, and the other thing is either a history consistent with supraventricular tachycardia or the documentation electrocardiographically of a supraventricular tachycardia. With other words, you shouldn't diagnose as WPW syndrome those asymptomatic patients that have ventricular pre-excitation during sinus rhythm in the electrocardiogram. This is Dr. White. Did all the 11 patients described in the original paper by White and his co-authors refer to history of recurrent palpitations? The answer is yes. Yes, but with the exception of patient number 7. Patient number 7 was an 11-year-old male without a clear history of palpitations. The rest of the patients had either a history of palpitations and or the documentation of regular tachycardias and occasionally of atrial fibrillation. For example, patient number 1 also had a documentation of atrial fibrillation. In the next two videos, you will learn first what are the different types of ventricular pre-excitation, then why do they originate, these different types of ventricular pre-excitation, and finally, in a second video, the lack of relation between the degree of ventricular pre-excitation and the risk to develop life-threatening ventricular rates during atrial fibrillation. Don't miss the next two videos on ventricular pre-excitation. We try to make short videos to facilitate the learning process. Thank you very much for your attention.